Hello.
Hi, Frederik. How are you doing?
Hello. Good, thank you. Nice to see you.
Likewise, likewise. We've not really chatted before.
No, I don't think so. I've seen you in meetings, but
yeah, we've. Were you involved in when Ruchir visited the IMF last month, at the end of December, I believe?
not really.
Okay.
I mean, I was aware, but nothing beyond that.
Okay. Yeah.
So do we have?
Hello, Frederik. Hi, Ruchir.
Hello.
Hi, Lizzie.
Hi. How are you guys?
Good, thank you.
Very well, thanks.
Good. I'm just I'll just be on mute. I'm trying to get my Miss Jonniah. She's part of the panelists. So let me just work on that.
Okay.
Good. Thanks.
So in my own camera, I'm hiding the CEPI logo. But, is that better?
I guess people have to guess the C in the.
Okay.
There you go. Yes.
Okay, thanks. Super. Okay, so it seems to all be working now. Okay, so do you know who the audience is for this event? I haven't actually quite caught up.
We will find out, I guess.
Yeah.
Researching to move to the third stage, which is what coming up with an outside from primary.
Welcome, everyone. We're just give it a minute or two for folks to join. Thank you for joining us. And if I can just remind you to mute your microphone.
And Jonniah has joined us, Carolyn.
Terrific. Welcome, Jonniah. And when you're ready, you can turn on your video.
Hello. Hello.
Hi, Jonniah. We know you're on. We can hear you. We cannot see you.
Oh, okay. I'm sorry where I am. I'm kind of in transit, so I'm not able to turn on the video because the light is not very good. Is that okay?
Well, if it's at all
you.
possible for the time you speak, that would be great. But if it's not possible, we'll do our best. We'd love to see you if it's possible. Welcome, everyone. We'll just give it one more minute as folks are joining. Okay, we'll get started. Welcome everyone, wherever you are around the world. Thanks for joining us this morning. The conversation we're going to have today, welcome to our Pandemic Action Network virtual stage, which we do the first Tuesday of every month. So you're always welcome here. And the point of our stage is really to foster some of the, what we feel are the critical conversations that we need to be having around the current pandemic and how to prevent the next one. And I must say, in reflecting on this conversation today, this is a conversation we hoped that we didn't have to have. As you all know, we are 2 years into this pandemic. This past Sunday was the 2-year anniversary of declaring the COVID as a public health emergency of international concern by the WHO. The official pandemic declaration is March 11th, but we've been in this crisis for 2 years. And we all thought that we'd be in a better place by now. We thought that we would be seeing the end of this crisis. We also thought, those of us who have been working on these issues for many years, and that we were seeing some light over the past year of finally attention to the issues of needing to get the world better prepared. And as you know, there have been some significant commissions and recommendations over the past year that have tabled once again the solutions on what the world needs to do. Unfortunately, neither one of these is true. Everyone wants to put this crisis behind us, and there's a lot of predictions out there and a lot of commentary about, once again, this is the end is near, we're moving to endemicity, it's, you know, we're just gonna have to learn to live with this, get beyond it. A lot of recent predictions about that. And I think we all need to be in this space to acknowledge that that is not true, those are premature. There was a terrific opinion piece yesterday in the Washington Post. If you haven't seen it, I would commend it to you, by Richard Hatchett, the CEO of CEPI, and Frederik, his colleague, is joining us today, by Jeremy Farrar, the CEO of Wellcome Trust, and by Richard Danzig, who was previously the US Secretary of the Navy. And I will quote the op-ed, which is true but chilling. "The prospect of declaring victory is seductive at a time of widespread fatigue. But the virus is not disappearing, it is adapting." And that is where we are. 400 million cases, nearly 5.7 million deaths, approaching nearly 1 million. We're going to cross that threshold sooner than we hope here in the United States. 10 billion doses of vaccines delivered, which is terrific, and you know, in many ways something to celebrate, but the inequity of that, 3 billion people still unvaccinated, 10% of people in low-income countries who have received vaccines. So, the trillions already that this has cost the global economy and impacts. So we know that pandemics are a choice. They are not inevitable. Outbreaks may happen, but pandemics are a choice. And so why are so many leaders just wishing this away, looking beyond it, and failing to do the things they know we need to do to not only end this, but to help prevent the next one? So that's why we're here. Something has to change. And this is the community that has to work to change it. That is why we are here. So we have a terrific panel to dig into this today. We have Ms. Jonniah William-Mollel, who's the Chief Executive Officer of the East Africa Health Platform, coming to us from Arusha. Welcome, Jonniah. We have Ruchir Agarwal, who's Senior Economist and Head of the Global Health and Pandemic Response Taskforce at the International Monetary Fund. Welcome, Ruchir. And we have Dr. Frederik Kristensen, who's the Deputy CEO and Director of People Planning and Policy for the Coalition for Epidemic Preparedness Innovations, or as we all know it, CEPI, coming to us from Oslo. Welcome, Frederik. So really all of them coming to this challenge from very different perspectives, but all critical to this conversation. So let's dive in. And while you are listening to them, I really hope that you will think about some provocative questions and comments, because again, changing this dynamic, changing this political calculus about inaction and the costs of inaction and getting political leaders to act really demands all of us working together from our different perspectives. Ruchir, let me start with you. You and your colleagues at the IMF, what now, 6+ months ago, 7 months ago, you've been really have written about what it will cost to end this crisis, and also the very compelling economic case for why we should be investing in pandemic preparedness and response. And you've raised some of these questions as well from the perspective of the IMF and the Taskforce about why we are not doing more faster. So set the stage for us. Why, on the costs of this crisis, the costs now, the costs emerging to the global economy, to the world, what are you seeing in terms of those impacts, and why aren't we in? Why is the world not acting? What do we need to do about that? Ruchir.
Yep. Thank you, Carolyn. Let me start by offering my gratitude to you, Carolyn, Eloise, and the whole Pandemic Action Network. What you all have done in the past 2 years has been terrific and has moved the needle, and all our gratitude for that. So thank you very much. In terms of, let me start. I thought that to set the stage, since you asked me to do that for a lively conversation, I thought I'd make 3 points, which, our starting point, exactly as you say, is the IMF's pandemic proposal, which was jointly written with our then chief economist, Geeta Gopinath, who's now our first deputy managing director. The 3 points that I would like to start setting the stage with are the following. First, we have emphasized that pandemic policy is economic policy. There can be no lasting end to the economic crisis without an end to the health crisis, exactly as Richard, Jeremy, and the co-authors Washington Post op-ed that you highlighted earlier. We just released our latest World Economic Outlook a few weeks ago. In that, we quantified the global loss from the pandemic so far in terms of economics, and that doesn't take into account the deaths and social impact. Just the economic cost is about $13.8 trillion. To put that in context, the annual output of the world economy is less than $100 trillion over this 5-year period in a given year. So that's over 15%, roughly 15% of a single year's world's output has been lost because of the pandemic over this the years that we've looked at. Second is not just a global loss, but there's a big difference between the cross-country impact. So there's a 2-track recovery. The world is on a 2-track recovery, and this is largely because of unequal access to COVID tools, vaccines, therapeutics, treatment, and testing. And also an inability of developing countries to provide as much fiscal and other macroeconomic support to cushion the impact of the pandemic. We had in our proposal set an interim target for the world for vaccination of 40% in every country by the end of last year. 86 countries did not meet that target, and actually we've been updating our projections every week. We project that about 80 countries or so are unlikely to meet that target of 70% by the middle of this year. So we are very much off track. And that's just vaccines. We are also off track on testing. The high-income countries are testing 70 times more than developing countries. So that's a big, that unequal access to tools is causing unequal economic impact of the pandemic. Last third point that is because of this, exactly as you emphasized, Carolyn, we are emphasizing the urgency to ensure equitable access to COVID-19 tools. And we are additionally emphasizing now that the world needs to take the pandemic, the current one and future pandemics, and treat it as a systemic risk issue and not solely as a development issue, which it also is. And once the countries, every country in the world can have an access to the comprehensive toolkit, maybe then we can declare that victory, because then we can move away from this fear-driven response to a managed risk response, so that people can continue to go about their lives, schooling, activities, and such. So those are the 3 points I would like to just set at the opening, and very much looking forward to this conversation. Thank you.
Thank you so much, Ruchir. Really great setting the stage for, again, what this is costing and how far behind we are, but also that, again, this is a choice. It is about choosing to how we treat this, not just as a health crisis, but as an economic and a systemic risk crisis. And it still boggles my mind that we are not doing that. Let me turn to Jonniah and see, Jonniah, you're joining us from Arusha, and obviously seeing with your network of partners across East Africa, and we're proud to partner with you and your and your colleagues. You see the impact of this pandemic on the communities in which you and your members work. Talk to us about that cost of inaction, of the slowness of vaccination, of the continuing pandemic, and why is it? Why do you see that lack of willingness to take the actions necessary to solve this?
Hello?
Yes, we can hear you.
Yes, thank you very much for the opportunity. I had highlighted earlier, my lighting is very low, but
Jonniah, we're losing you. I think, are you on mute? Can we try again? I think we may have we lost her? I see you there, Jonniah, can you hear us? Let me come back to you. I'm hoping that we can fix your audio. I will come back to you in a moment in hopes we can fix your audio. Frederik, let me turn to you then. Ruchir talked about the broader economic and systemic impacts. You come at this as from CEPI. You're deep in it in terms of both the effort to get the world vaccinated, but also to stay ahead of the curve on the next round of variants and to prepare for the next threat. So I mean, building on Richard Hatch's comments in that email, in that op-ed, you know, where are we, and where is why this, and you are preparing for next month for a pandemic preparedness summit. Well, where are we on on making sure that we have the tools that we need to fight this crisis? But again, why is this so hard? Why are we not getting leaders to do the needful to get ahead of these threats?
Yeah, thanks, Caroline, and thanks to you and the Pandemic Action Network for putting this together. Well, I think that's a hard question, actually. I mean, it's to many of us who are engaged in this, it sort of seems like a no-brainer. But of course, then real-world politics hit, and so I think there's an element of that we've seen play out of what's called the prisoner's dilemma in academics, i.e. that we would all be better off if we were really able to collaborate and cooperate on this, and make sure that we had equitable access to all these tools. But we're not quite sure if we can trust everybody else, so we need to make sure we get out ahead. And I think that's a fundamental challenge. I don't know quite how to get around it, except to say that I think I'm thinking in two dimensions. One dimension is to be able to now maintain both a focus on ending this pandemic and not letting our guard down too early, as Richard and the others were writing, but actually think through what scenarios we can still be facing and how we need to prepare for that. And including in that is, of course, the push for more broadly acting vaccines, so that we can make them as variant-proof as possible, so we don't get surprised by future waves of new variants. At the same time, we also need to start thinking about how these investments do help us be better prepared for the future, as well as ramp up that future preparedness. And so I think part of the onus is on us to explain to the world's politicians and governments how all these pieces need to fit together, because we need the whole plethora, from better surveillance to being able to define what variants we have, map the genetic sequence, through to developing countermeasures like vaccines, but also medicines, and having the equipment, and then really making sure that they get deployed. So there's a need to support both the ACT Accelerator overall financing ask, COVAX and the COVAX advanced market commitment as an important, critical part of ending this pandemic, but also research and development, like from CEPI, on these more broadly acting vaccines, and start on the research and development agenda to be better prepared in the future. So this is, complicated, but I've been able to explain how all these pieces fit together, and that, you can't just cherry pick. You should really think through how we do this as a holistic system is going to be critical, I would surmise, for getting through to the future.
Thanks, Frederik. I'm going to come back to you and to Ruchir a little bit more on that narrative of what is how do we actually change this political mindset and calculus? What are those magic words and magic arguments that we need to say? Because it seems, for those of us working in the space, it seems logical, but still we are challenged with getting this to be prioritized at the level that it should be. Jonniah, let me come back to you. I think we saw you briefly on screen, and hoping that we can hear you now. Are you with us?
Yes, I'm here. Thank you.
Terrific. So we'd love to hear from you. You're in Arusha, you work with your members across East Africa, and you really are seeing from the front lines the impact of this crisis on communities, of the lack of failure to get vaccines and other tools out there to communities that need them and want them, the impacts on the health system. And you also are talking to leaders in Africa and about this crisis. So from your vantage point, what are you seeing as those impacts on especially not just in response to COVID, but on the broader health system and on these communities? And what are some of those priorities that you're telling leaders they need to focus on now? Jonniah, have we lost you again? Asking one of my colleagues to let me know, has she dropped? I don't see her on the screen. So apologies that we're having so many technical difficulties. This is the beauty of, or not beauty of Zoom. I see her on the screen, but I think the audio for some reason is not working. Jonniah, if I can just try you one more time to turn on your audio, because we are not hearing you. Okay, well, I apologize that we're having so many times. We will bring her in as soon as we possibly can into the conversation. So yeah, let me go back to Ruchir and to Frederik, both of you. You both laid out very well the kind of where we are and what needs to happen, but what will it take to effectively make that case for investment? Again, both on ending this crisis, but also on response, because you would think that the numbers of deaths, the numbers of trillions of dollars, all of that is compelling enough, but for some reason that's not doing it. So what is the magic solution here? What is it that we how do we actually shift this into a sustained effort to keep the threat of this pandemic and future pandemics front and center? Because it's not for a lack of trying, it's not a lack of knowing what to do, it's a lack of political leaders actually deciding to do it and prioritize it. We have the money. Ruchir, thoughts? You're on mute, Ruchir.
Yes, let me pick up where Frederik left off, which is, I think we need to, it's in a way a crisis of imagination as well. The onus is on us for clarifying why the pandemic has had a comprehensive impact across all aspects of society and economy, but also why future pandemics why pandemics will remain a threat in the future, why both the COVID pandemic itself can evolve further and pose additional systemic risks, and other pathogens continue to pose risks. So the investments in R&D case Richard Hatchett and Frederik and others have been making in CEPI is a very strong argument. One more point that is important here is the time value of action. You know, we talk a lot about the time value of money, but acting 1 week earlier itself translates into lives saved and better economic outcomes. So one example that I may have shared with you all before is this thought experiment that if COVAX had raised $10 billion, which it managed to do until the middle of last 2021, if they'd done it 1 year earlier, the world would have been in a very different place. So I think it's incredible what the international community has managed to do with COVAX delivering 1 billion doses. But what we need to now do is also shift that into acting earlier to take into account the time value of action. So let me stop there and come back. Oh, perhaps maybe one thing I just want to add, which is a very important point that Frederik said, is this unified approach. What's happening is this pandemic preparedness discussion is happening now almost in parallel to the COVID approach. There are a lot of returns and multipliers of health spending if we treat these issues as a comprehensive approach and not just deal with these things separately. So that I very much second that point as well.
I'm so glad you brought that up, because it is, too many times I can't, the number of times we've had that conversation with policymakers of like, well, we'll deal with that later. It's like, no, this is the time to deal with it. While frankly, there is it is front and center for everybody. This is because we've seen that cycle of panic and neglect happen all too often, where out of sight, out of mind, and we'll worry about that problem later. But it's also about preparedness for the next evolution of COVID, right, Frederik?
Absolutely. No, absolutely. I think I mean, I think building on Ruchir's point of speed, because that is part of the realization that we had when we launched a plan for the sort of our next 5-year period, was exactly the same in terms of research and development. You can do the same thought experiment. If it was amazing to be able to have vaccines in less than a year this time around, but still you see what devastating impacts even this kind virus has. And so being prepared for other viruses, whether it's SARS-CoV-3, which could, if it has some lethality like SARS-1 or like MERS, which are 20 to 70 times more deadly than the SARS coronavirus we have, you can just imagine the devastations. Or if it's another virus from another family. So to be able to react quickly, we've said, we've put up a goal, which is really a moonshot goal, we call it, 100 days goal. This time it took about 326 days. If it's really deadly, if it's really terrible, we should be able to do that in 100 days. And it sounds amazing, but it's really more of an engineering problem, because if we can prepare for the virus families that we know are really challenging and have semi-ready vaccines for these different families, so we have a library of vaccines for the different families. If we have the follow-ups from COVAX and other instruments in place, if we put all this in place, it could actually become reality one day, and that would really make a dent in the curve, to be able to react so quickly and so early to limit the impact of future pandemics. But again, the investments we make now in more broadly acting COVID-19 vaccines do lead into more broadly acting coronavirus vaccines. They lead into understanding of different vaccine platforms. All of this is also preparing us for the future. So I think that's a really important aspect.
Thank you both. I want to turn back to Jonniah. We can see you, and hoping we can hear you as well. Just would love to come into the conversation. Anything you want to react to on what the other speakers have said, and again, just from where you sit, how you are seeing this crisis and that cost of inaction from political leaders, and what do we need to do? Jonniah, your sound is off. Yeah, I can see you speaking. Can you unmute yourself?
Yes, I'm unmuting, and I'll be really quick.
Now we can hear you and see you. Yeah. Great.
So quickly, I will chime in with 2 words: the choicing game, alluring to prioritizing vis-a-vis time, but also the risk perception. This is what I'm seeing where we are. We've seen COVID, but to the greater extent, many of our leaders and ourselves are not seeing the adverse impact of the pandemic, but also in terms of intensity and the time, that the impact that we are seeing now might take a long time, might impact on a lot of systems, but also based on the EHP dialogue we did, we saw a lot of impact in terms of workplace and the human capital and how it is affected now and the future. So given what I'm seeing is that the cost of inaction will not only cost us in this particular generation, it will take a long time to reverse, but at the same time, our systems, the money, the investment that is going on, that is going in, we are questioning whether it is building systems to improve the whole economy and improve the whole health systems. So I think the bigger question is that, are we seeing the level of the risk perception of the leaders is the issue, given the data, the numbers that we have. Is COVID today's question, or the impact we are seeing is going to go for generations? And that means the difference between 9 a.m. in the morning And the difference between I'm making a decision right now and later in the day is going to cost the generations. This is my message on the table. So in terms of production of whatever tools and medicines or vaccines, but at the
I think you froze for a second there. Oh, or is that me? That might be me. Okay, I think we lost you. All right, well, those were some. Jonniah, are you still there?
Yes, I'm here, and maybe I conclude because of my connection. I think for me, sitting in Africa, in East Africa, my message to us and the leaders is that the choice we make today will cost us for a long time. And we are seeing many of our countries making it you have to opt in or out for the vaccine, which is a question because one's choice at a point might be impacted because might be.
So thank you, Jonniah. I think we lost you again, we froze, but I think your main point was well taken, that the choices we make today are going to be felt for generations. And I so strongly identify with that, and I feel that that message is not coming through enough. There has been talk, as Ruchir talked about the dollar signs, and euros ticking up in terms of what this is costing us now, but there's not been enough attention to what this is costing in the future, the decimation to health systems and to the health workforce, the impact on other health outcomes and development outcomes, the rise in poverty reduction, the rise in poverty, what the first time in 2 decades, right, Ruchir, that poverty levels have gone up, health outcomes being set back. There's some question about whether they're stagnating or how far back they've lost, but there's no question we've lost ground on every measure, from HIV treatment to women and children's health, TB, et cetera, you name it. So all these other investments that the world has made over these many years are also being put in jeopardy. And what I think is not being said enough is that we're less prepared than we were at the beginning of COVID, right? As a system, we have these tools, that's great. We maybe know a little bit more than we did before, but actually the systems that we need, particularly on the front line to prevent it, are even tougher. We have a lot of, our chat is getting very lively with comments and questions. I wanna turn to our audience. Ruchir, there's several questions for you about the, about what the, how the IMF has been challenging its own thinking and offering different approaches to finance in order to encourage greater investment by leaders and particularly finance ministers, right? At the end of the day, we know they control the purse strings. I spent many years at the World Bank. I know that well about how you have to talk to finance ministers. So this does seem to be still too much. Pandemic preparedness and response is still too centered in a health conversation. So what is it that we need to do differently with respect to engaging finance ministers and making that case? And also about the obstacles countries are facing on hiring surge staffing. So a couple of, I think there may be something else, but maybe you can dig into those.
Yeah, sure. So let me say, in a way, the IMF's, we are a macroeconomic institution. So our initial response was providing emergency financing at an unprecedented scale. And at the same time, exactly as you're saying, a lot of our projections of how the economy and each country's trajectory was evolving depended on the path of the pandemic, which is why we ended up writing the pandemic proposal to generate kind of a global strategy, or push at least the global strategy to having that comprehensive response. On financing, we've also, there is discussion now of what's called the Resilience and Sustainability Trust, which is likely to also focus on pandemic preparedness. There's conversations ongoing on that. So we are continuing to challenge ourselves and evolve, but always we are also open to hearing ideas. So this conversation is very helpful. Let me say one more quick thing on the imagination point. We also, the staff of the fund continue to challenge ourselves in the analytical side. So one of the areas we're looking at is not just the within country inequality that you've mentioned. Our estimates show that about 65 to 75 million folks have been additionally put into extreme poverty, but also the intergenerational inequality. So in a way, what I'd like to call that is the macroeconomy's long COVID, which is each generation will carry the scars from the pandemic for decades in different ways. We know from the global financial crisis that the youth that entered the labor force in those years have had long-lasting, often permanent effects on their career outcomes. And many of those millennials actually are facing a second shock in their lifetime. So the shock those folks are facing is very different than the folks who've had learning losses. We have just done some analysis that about twice as many school closures are about twice as long in developing countries than in advanced countries. So part of our challenge is also to quantify these and put it on the paper so clearly, such that it's very hard to ignore these effects, and such that we can get the world to move on ending the inequitable access to tools today.
Thanks, Ruchir. I think you've found your calling not just as an economist, but as a communicator, because I'm going to use that, the macroeconomic long COVID. I think that's very compelling and very clear. And we need to start talking about that more. I also think there's some data I know the World Bank has produced about the projections for low-income economies over the coming years, right? And there's a lot of money being pumped into the international system right now to deal with this, effectively or not. We can argue that, but there's money in the system. But what is going to dry up after this is over, and that's going to, and debt is increasing, and there's more money being spent on the health sector. We're likely to see policymakers shift their attention to other issues and other challenges exactly when they need to be shoring up those health systems. So we could actually see this ripple effect and compounding effect that we could see is really frightening. Frederik, there was a question in the chat about AMR. I know that's not what CEPI deals with, but as another pandemic, and obviously there's HIV/AIDS as a long-term pandemic. You've worked in WHO and elsewhere, and so you know the health space very well. As you go into, CEPI is focused on R&D for epidemic and pandemic potential diseases. But as you go into your replenishment conference next month for CEPI, how are you going to stitch all of this together to really make that case for investment for not just CEPI, which we want to see fully funded because it has a vital role in the ecosystem, but also for global health more broadly?
No, indeed, I think it's really important that we all, remind the decision makers that it's important to think of the whole system and really getting all of this funded. And of course, as we've been discussing, one would think that the economic argument of investing some billions and getting trillions back is a no-brainer, but apparently it isn't. So I'm wondering about one aspect which we haven't touched so much on, and I think Jonniah brought it to life. The impact of this and the stories of the impact of this are so important to get really documented, not illustrated, but really documented, and that the human impact, as you were touching on as well, Caroline, that on poverty, on impact on other parts of the healthcare system, which is falling to pieces, reduced vaccination rates. The human impact of this is grossly underestimated when we just report, the number of registered deaths. that in itself is probably an underestimate, significant. But so I think we need to bring life to this true story of the devastations that are happening, and because trillions are sort of a bit too abstract for most of us. And so that's one aspect. The other aspect is, I think the narrative really needs to focus on sort of the whole of government, or the need to be, engaging from not only from development side, but also from research and development, from security, from all aspects of government. Because this is, the ideal scenario going forward is more like having funded a fire station which is ready to go once the fire bursts out. And so rather than having to then run around and, oh, let's build a fire station, and where can we get the money from? So the whole concept of preparedness needs to be really systematically implemented. And so I think hopefully in that light, a 3.5 billion ask for the research and development part of this is really small change. And if we can focus on getting the science right, and ensuring that the investments we make there do support access, then I think we can be better prepared in the future.
Thanks, Frederik. Yeah, I'm struck. I mean, there's the $3.5 billion ask for CEPI, again, a very small piece of what this crisis is already costing the global economy, and that we know it will cost, as Ruchir has laid out. We have the Act A investment case which is 23 billion or so. Again, sounds like a big number, very small in terms of even on a monthly basis what this is costing us. And the things that we can't even put a price tag on, right? Which are lives and livelihoods. It's incalculable. But then, the Global Fund has a replenishment coming up later this year. It has a critical role to play in, addressing the existing challenges of HIV, TB, and malaria, but also has an important role to play in pandemic preparedness. The Global Financing Facility, which is not about pandemic preparedness, but it's about shoring up, helping countries shore up and strengthen their health systems and essential health services. So, but even if you put all of these things together, it's still not a lot of money, and yet we can't even seem to get over that threshold. We have some summits coming up, and we have, in addition to the CEPI RM campaign, as I said, we have a Global Fund, we have COVAX, et cetera. So we have multiple moments where there are appeals for funding. Thoughts from either one of you or from anyone in the audience about how we make sure that these don't become these should not compete with one another, that these are actually positioned as parts of what we have to do to strengthen the entire global health system. And it's not just about strengthening the global health system, it's right, as you just said, this is about taking this beyond a health issue and how we strengthen the international system as a whole, how every nation, how every region, and how the world is better prepared. Thoughts about how we make sure that we don't rob Peter to pay Paul, to use a phrase, or see these as in competition when in fact they are mutually reinforcing. Either one of you want to come in on that, Frederik or Ruchir?
Well, I think you just said it very eloquently, Caroline. I think that's the core point, that these are not competing, but actually reinforcing. And we need to support the Global Fund and its work. We need to support GFF. And so, having strong healthcare systems in countries that they are supporting is critical as part of our overarching mission, which is to save lives and make the world a better place. But I think we do well in reminding ourselves or each other to and maybe try to simplify that message, because maybe it becomes a bit too complicated. We are having our pandemic preparedness event, and then there's these other events, and then governments get run down from different parts of the system, and so ideally we should be able to align our own messaging as well as possible.
Ruchir, you want to add to that? And Also, I might ask you alongside that, why is it that we are not seeing, only a few countries have actually done emergency funding supplementals? Not, why is that not happening? And the IMF has released SDRs. I know there's a lot of people that maybe don't understand that all so well. So maybe you can touch on a couple of those things as well about what is the money also that's out there, but why aren't, what is the advice to economies about the most effective way to finance these things?
Yeah, so I would say, in a way, the way we've been emphasizing this fundraising seasons that coming up, as you say, we've emphasized 4 broad principles. The first one really is about what you're saying, which is we need to treat this pandemic spending as a systemic risk issue. So it really has to come out. We should not be crowding out the ODA, what's typically financed in development assistance or the ordinary development assistance. We need to have kind of a non-ODA additional financing, which takes a systemic risk perspective, and especially recognizing that doing something for your neighbors is also good for you. That's the idea of the global public good. So this is different conceptually, philosophically, financially than just the ODA, and that's why we say treat it not simply as a development issue, but as a systemic risk issue, a health security risk issue. Peter Sands, the head of Global Fund, has said that one of the worst things that happened to the fight against HIV, TB, malaria is COVID. And we really cannot allow that kind of crowding out to happen. It's upon us. Second is it's important to not just emphasize vaccines. We need to have a comprehensive toolkit. Vaccines were important for many countries early on, but now there's been a large movement on the supply of vaccines, but countries also need access to testing, oral antivirals, PPE. So we need a comprehensive toolkit approach. That does not take away from the important work that CEPI is emphasizing on the R&D side. And so that's it. The third thing is, it's very important from our perspective to recognize the in-country delivery issue. So in many ways, the world has solved on the vaccine front. 2020 was the year of the lab, where we were trying to solve the R&D problem with vaccines. 2021 was a year of the factory, where we're trying to solve the supply chain problem with vaccines. And 2022 is now becoming the year of delivery, where we're trying to focus attention on developing countries and solve in-country. So as much as possible, we start doing these at the same time, but also going forward, much more focused, both financing and strategic, high-level attention to get the in-country problem solved. So, and the last thing very quickly, I would say is, which is what Frederik has emphasized very importantly, is taking that unified approach to financing. And not, one of my worries is in 2 months from now, if indeed some of these baseline scenarios materializes, that cases come down and death rates come down from COVID, which is a great plus for the world, but we may lose the impetus to act. So if we can already work to integrate the financing agenda for the pandemic preparedness, for universal healthcare and COVID into one framework, also as Frederik has emphasized, then we no longer have to worry about, the path of the pandemic in terms of how the world will react, but we have a comprehensive approach to dealing with that. So, yeah.
Thank you so much. And I'm really just want to put a two-hander on your point about the that this is we don't crowd out other global health needs. These all have. There's a reason why we set up all these institutions that we have, and they still have jobs to do, and those jobs are even more important in the wake of this pandemic. But we have underinvested in preparedness as a global community for far too long. There is a major deficit there. The G20 high-level independent panel in its report last July spelled that out very clearly. It spelled out the need for investment in a strong, we haven't talked about WHO today, about reliable funding. We're asking WHO to do a lot, and its funding base is highly unreliable. 80% of it is dependent upon voluntary contributions. We need to shift that calculus, and we need to shift it fast. That conversation is underway, but there's a lot of political resistance to doing that because countries will be sent a bill that they don't want to. This is a global challenge that requires global solution and global financing. The high-level panel has also called for a new financial intermediary fund to, again, not to supplant what other global health agencies are doing, but precisely because we've underinvested too long and there's a deficit of investment at national, regional, and global level. So to close those gaps. I know, CEPI has a job to do, but it can't do its job if those other parts of the system are also not strengthened. So it all has to work together. We're nearing in our last few minutes. Frederik, there was a question for you. There's a couple last questions in the chat. There was a question for you, Frederik, about, there I go, on the, I'm doing a terrible job as a moderator. I've just lost my stone thought. You can take a look at the chat. There's a couple questions for both of you. It was on development of other vaccines. There's questions, Ruchir, also on debt servicing, and a great question from Jim Gannon. Are you satisfied with the political leadership you see coming out of the US? I don't know if you all will want to comment on that, but maybe we could take that more broadly to the G7 and what you feel needs to be done and by whom to drive a more coherent and well-resourced response at this point. I think that is the question we should all be asking. There's a White House summit coming up at the end of March. That is a follow-up to the COVID-19 summit, but there's also a G7 summit in June. There's G20. Each of these, are we seeing the leadership we need to see? And if not, what do we need to do to get them to effectively pony up and lead and do what's needed to tackle these global challenges? So Frederik and then Ruchir. I don't know if, I think Jonniah is not able to speak, but I'd love to hear a couple last thoughts from you on those points.
Yeah, that was a great question because it also opens the door to, demonstrates the value of investing in a vaccine platform like mRNA and how that can also, even if we do it for emerging infectious diseases, improving the technology and the platforms will have spin-off effects for other diseases going forward. So you'll be seeing, a long call for proposal from CEPI to be able to have more thermostability around these vaccines, for example, because of course, the ultra cold chain is a big challenge for the world. So we still need to invest in improved vaccines, and those investments will also have spin-off effects for other diseases like TB, malaria, or other diseases. So again, things are connected. And in line with that, I do think, Ruchir, I think you're right that we've seen this development from 2021 and now focus on 22. I am afraid, though, that we lose sight of, this being only, or if we think that this is only now a delivery issue, I think the virus will come back to bite us. So we shouldn't underestimate the need for still better vaccines, unfortunately. We've talked about more broadly acting, but we also still need, ideally, vaccines that are longer acting, that are thermostable, and that also can protect against transmission, ideally. So there's a lot of undone work here. We were very lucky to get vaccines so quickly, but they're in fact not the best. And then finally, to your point, Karen, I think are we seeing the political leadership? Well, I think the rhetoric is good, but the action is missing from G20 and G7. I do think that initiatives like getting mechanisms in place, like the financial intermediary fund, something that can channel monies and provides a long-term vision for getting this fire station up and running, is things to support. And it's great to see that those discussions happening. But of course, talk is cheap, and we need to see it being established and getting it funded. So we need to keep the pressure up.
Great. Ruchir, thoughts on that, or any of the remaining questions in the chat that you want to pick up?
Sure, let me just get three things. So first, Frederik, fully agreed on the importance of R&D. There is no doubt about that. So that is, I very much agree with what you and Richard Hatchett and others in CEPI have emphasized on the systemic and global returns from that. Second, on the comment in the chat about the debt burdens, it's a very important issue that one of the impacts of the pandemic has been the divergent fiscal impact in developing countries compared to advanced countries. And that's exactly why in our pandemic proposal and in our continued advocacy, we've emphasized the importance that the support from donor countries to developing countries should be on a grant basis and as much as possible centralized such that we can exactly mitigate that impact. And then for the residual needs, have concessional financing from MDBs. On the third point on leadership, I would slightly deviate, if I'm allowed to, from Frederik and say one of the very good things we have now is attention from the global leaders on the issue. I think it's incredible the amount of attention there is, and it's also upon us to work with that attention and provide a roadmap collectively, and what we're doing now, a conversation like this between civil society, health folks, economists, and that's exactly the challenge for us, is the imagination challenge. And in many ways, what we do have is, for example, in the last year's US summit, an embracement of the global targets. So we have a clear path now what the targets are. We have a clear path on what the financing asks are. And now we need to just get mobilize the financing and then the action on the ground. So I'm a bit more optimistic on that, mostly because I believe in us collectively doing something about this in the ensuing months. So thank you very much.
Well, I like the positivity, because we all need some hope to stay in this course. I'm going to ask you just both 30 seconds before we close. Again, we're at the 2-year anniversary mark. We know this is not over. We know that this virus is evolving, and we know we have to get on it with preparedness. What's your greatest hope for 2022, where you hope that we'll see real action, both on ending this crisis and preventing the next pandemic? Frederik?
Well, my biggest hope is that we will actually see, the establishment of something like the fifth and a global governance mechanism as being discussed in the G20. I think if we can get that in place, I think we've made a big step forward. And then secondly, of course, I hope to see a fully funded CEPI. I have to say that, but as part of that bigger puzzle. But it's, that if we can get those two pieces in place, I think we've made a big step forward.
Excellent. And we also hope that we will see a fully funded CEPI. Ruchir, last word on that?
Two hopes. One is make living with COVID normal again, in a way such that people can, even if there are surges of cases, even if there are new variants, we don't have a fear-driven response. Every country of the world, people can still recognize they have access to the tools such that they can go about school, work, lives, and not get hospitalized. So that's one. And the second is, it's remarkable the human ingenuity in terms of the R&D developments on vaccines, therapeutics, wide range of action. One of my hopes is we can translate that incredible response to other of the biggest challenges facing the world, including on the R&D challenges that Frederik has talked about, but so much more. Why should we wait for 4 or 5 years for a TB vaccine? Why can't we use that energy to translate and solve additional problems facing humanity? So those are my two hopes.
Thank you both. And I want to thank Jonniah, who I know had to drop, for just such insightful comments and energy, and for that hope. That word imagination is going to stick with me today, and I hope with all of you. We need that imagination, that ingenuity to solve these big challenges, but that should inspire us all, right? Just as the original moonshot to get to the moon inspired a generation of scientists. and you know, reminding us again, pandemics are a choice. We're not done with COVID. We are done with COVID, but it's not done with us. And we really have to translate that attention, as you said, Ruchir, right now, while this pandemic is still sadly in front of us, into real action. So thank you for those thoughts to help us to sharpen our advocacy. Thank you all of you for joining. Welcome further comments and thoughts afterwards. I know we didn't get back to all of the comments at the end, but this is an ongoing conversation, and we need all of you in it. So thank you all. Have a great day wherever you are.
Thank you so much.